Hi there. Thank you for joining us for an explanation of ECCO training in interior health. My name is Sybil Hoyce. I'm the clinical nurse specialist for the Critical Care Network for Interior Health. So I help support the education and practice of all of the high acuity units and ICUs within interior health. I've been a nurse for more than a decade. All of that has been in critical care. I worked at Fraser Health, Royal Columbian Hospital, as well as bedside nursing at KGH. And I've been in this role for over 3 years now, helping support the practice and education across our health authority. My role in this training is I help design the curriculum and help work with my partner, Lindsay, that's going to introduce herself next, for how to deliver the curriculum virtually and in person to help support the training needs in interior health and provide a really good experience for our students and for our site leaders that are supporting those students.
Hello, my name is Lindsay Dion, and I am the Regional Educator for the Critical Care Network. My role in ECCO is to coordinate the education that happens throughout ECCO. I have been nursing for 18 years, primarily in critical care, throughout interior health and in Providence Health. And I have been teaching ECCO for over 4 years, and regionally, we've been teaching this for coming up to a year. So I'm excited to let you know what ECCO looks like, and let's get started.
So I'll just provide a bit of an overview for our critical care sites in ICUs, so you know where our tertiary ICUs are, our regional ICUs, and our rural high acuity units are located. So intensive care units are resource intensive and provide multi-system care for critically ill patients. Tertiary centers offer more services than regional centers. Interior Health has tertiary ICUs in Kelowna at KGH and Royal Inland Hospital in Kamloops. Our regional centers are in Vernon, Penticton, Trail, and Cranbrook. High acuity units provide acute care and closer monitoring than is available on a general hospital ward. High acuity beds are located within the ICUs, and staff may care for both ICU and high acuity patients, including vented and non-vented patients. For our rural high acuity units in Williams Lake and Salmon Arm, there is no ICU on site, and patients needing higher level of care are transferred out to regional and tertiary centers. Training at CMH and SLH includes training for ED practice because staff at those sites work within both units. Training is extended for those sites to allow for that extra knowledge and practice. For all ECCO students, an ECG course is provided if needed to prepare for the more advanced cardiac content in the modules. ECCO is an accredited critical care online theory course through AACN. The majority of nurses in the United States are trained using this course, and it's been used in interior health for over 20 years. The module content has been improved year after year and includes case studies and interactive learning for each body system, linking them together as the modules progress. For our rural high acuity units in CMH and SLH, emergency nursing orientation modules are also provided and included within the practice at those sites. The training is extended, as I mentioned, for those sites to provide time for that extra learning. And if during the preceptorship, if we try to arrange 1 to 2 sets in a higher level of care, and travel expenses are provided for that. So you would be covered for travel.
So in the first part of ECCO, in weeks 1 to 7, we have a variety of lab days, clinical buddy days, and study days. So the lab days that we have, you can join from home, and they're presented virtually through MS Teams. Now, these lab days are facilitated by myself, and we have guest speakers who are expert in their fields that come and join us as well and present to the group virtually. We also have on-site lab days. Now, these lab days take place with your unit educator, and these are used to practice new hands-on skills that are introduced throughout ECCO. Now, we usually start these lab days together virtually, where I will present clinical practice standards, and then we'll break off into our unit groups to get that hands-on practice. Now, the buddy days or clinical days are clinical days that are spent on your home units. Each week has a theory focus, and we hope to apply this to practice on your home unit. These buddy days start out as 8-hour shifts, and we progress into 12-hour shifts so that you can get a good idea of what a full shift looks like on your unit. These buddy days, you are paired up with a buddy nurse. That nurse will likely be different for most of your buddy days, but you do get a good idea then of how different nurses practice in critical care. Now, we also have study days that are devoted to your ECCO module work throughout each week of ECCO's week 1 to 7. There, on these days, you get devoted study time so that you're able to get all of your theory work done. Now, here's an example schedule of, we have a sampling of weeks 1 and then week 6. And here you can see that we have a variety of things happening in each week. So you can see that we have join from home lab days, we have clinical days, study days, and then on-site lab days. And it's very well outlined in the schedule. You can also see that we have theory that corresponds to each day and each week that we're working through. Depending on if you are in a regional site or a tertiary site or a high acuity unit, your on-site lab days may look a little bit different, and they're suited to your site and to what you do and what your practice will be there. Now, in ECCO's weeks 8 to 12, we focus on preceptorship. So during these weeks, we have 16 shifts of preceptorship for the ECCO students, and there you're paired with a nurse on your home unit. So whereas in your clinical and buddy shifts in week 1 to 7, you do get a sampling of different nurses, now you're paired with one nurse that's going to take you through these 16 shifts. Our preceptors are well supported, and they are well supported with the preceptor manual that we have developed for ECCO. This manual clearly outlines the theory that we go through week by week, what the expectation of the student is and of the preceptor. There's also additional preceptor training that is available for these preceptors, and interior health preceptor development resources on the IH team site as well. There is always direct communication with the regional educator and support from the site educator. So lots of support and resources for the preceptors to better support the students and provide a great learning experience on their units.
For training at Caribou Memorial and SLH, ED theory and practice is also included and supported by the educators from both ED and critical care. The training is longer at these sites, 15 weeks, and clinical buddy shifts will be balanced across both units at the sponsoring site. Preceptorship will occur in those units as well, with some preceptorship shifts at a higher level of care. And as I mentioned before, travel costs will be covered for this, and we will try everything we can to get you some time at those higher level of care. It's really a valuable experience because you get to know your sending and receiving sites as you would transfer patients if they needed higher acuity. So that's really a valuable experience that we try really hard to get for you. Training at these sites also includes managing mechanical ventilation. This is included with module learning and also hands-on and virtual labs. Typically, high acuity training does not include mechanical ventilation, but we, with our circumstances and the location of some of our rural high acuity units, sometimes travel and transport can be delayed. And so it's absolutely necessary that staff in these units are also supported with mechanical ventilation training and practice.
Student evaluation. So students are evaluated and supported throughout ECCO training. We do this through buddy shift milestones and feedback, which take place through your buddy shift or clinical days through those ECCOs week 1 to 7. The buddy shift milestones and feedback are done collaboratively through the student themselves and their buddy nurse that they're paired up with. We also have preceptor milestones and feedback done much the same way, but just with your one preceptor that you'll have for preceptorship and through those 16 shifts of preceptorship. Now, we also have a skills checklist at the end of preceptorship that is to be completed, and that's to maintain that we have done all the critical care skills that are new to us, we've had a chance to practice them, and can go into independent practice confidently. There's also a critical care competency document that is filled out that outlines all of the critical care competencies. And then we do get you to reevaluate this competency document 3 months into your independent practice. This is a great way to develop a learning plan and to see where your learning is headed and to see also where it came from. Now, there's also regular check-ins with regional and site educators throughout the program to make sure that the learning and the experience that the student is getting meets their needs and that they are able to successfully complete the program. So training completion. With training completion, we look at the 3 components of ECCO. So we look at theory, clinical practice days, and preceptorship. So for the theory, we want to make sure that the student has successfully completed their AAC and ECCO modules. So 100% of the ECCO modules need to be successfully completed. These are also used in the emergency specialty training. Also, we need to make sure that the clinical lab or your practice days, your buddy shifts are successfully completed. So 100% of these clinical days will be done in your either ICU, regional or tertiary site, or in your rural high acuity unit. So, and we are looking at the buddy shift milestones to look at completion and successful completion of these training days. Thirdly, we're looking at preceptorship. So in your ICU training, 100% of the preceptorship will be done on your regional or tertiary unit. In your rural high acuity training, 50 to 100% of the preceptorship will be done in your rural high acuity unit. We do try to arrange 1 to 2 sets at a higher level of care. That's just to increase exposure to frequency of conditions and treatments that are available there. Now, if you are awarded a training line in an ICU, you do receive a certificate stating that you have successfully completed ECCO and the completion of intensive care training. If you are awarded a training line in a rural high acuity unit, you receive a certificate saying just that. So you've successfully completed ECCO and the completion of a rural high acuity training has been done. Now, upon completion, 18 months return of service is expected from you within the unit that sponsored your training. Rural high acuity training, remember, includes ventilation training and practice, so you don't miss out on any of that learning. If after the 18 months return of service, you wish to apply for a position at a regional or tertiary ICU, additional training will be provided by the site to support the specialized services offered there. However, remember that the rural high acuity units have a community feel that you may not want to leave. The problem solving and collaboration that happens in those sites offers a vibrant and diverse practice experience, making you a very valuable resource in those communities.
So that brings us to the end of our description of the ECCO training for interior health for our rural high acuity units and also for our tertiary and regional ICUs. We hope that this session has provided some answers to some of your questions about the process and what week by week looks like throughout the ECCO training. If you still have any questions that you'd like to run by us, please feel free to reach out to Lindsay and I, or the manager of the sponsoring unit you would like to work at. Thanks for tuning in for this, and have a great day.